Well, today we start again with my second point with my attire as a surgeon. Today is my operating day, and I take my time today just to explain certain things regarding to the weight loss clinic. We talked in the previous episode regarding to the 5 big mistakes that people take. The last one was regarding to go straight to bariatric surgery. First of all, let's conceptualize what is bariatric surgery. Bariatric surgery means it's a weight loss surgery that encompasses a group of operation to help to lose weight, but making proper changes in your digestive system, either in the stomach, in the intestine, or places where the hormones need to be absorbed and the nutrients need to be absorbed or need to be worked. Metabolics, in terms of concept, is regarding to how our body gets energy. Metabolic is what that means. And bariatric means related to the treatment to the heavy weight. That is two big concepts. What is including bariatric surgery? In the world, there's a lot of type of bariatric surgery. Let's talk about more than 30 years ago. We are doing all the bariatric surgery opening. We call Weyand-Rooks gastric bypass. It's when you cut part of the stomach and you make the junction with the small intestine. This kind of operation also is dedicated, one of the principles in surgery for patients with complicated duodenal or gastric ulcer in the way of the antrum. But well, it's used as well because it reduces the capacity of the stomach, but it's a huge operation, have a lot of complications. One of the most frequent complications has been seen in those patients that has been doing or they did the gastric bypass as a bariatric surgery. First is the ulcer in the new anastomosis, is very frequent. The iron deficiency, vitamin deficiency, the weakness, sometimes bloatiness, epigastric pain constantly, and heartburns, gastroesophageal reflux. And I'm not counting the complications that happen during the surgery in hospital. They are very important to remark because they are, most of them they go very good, and some of them they are not very well, and they have a lot of complications that is not part of this episode to explain. We are dedicated to weight loss. But okay, people, they do it, and there are several types. All of them right now, with the technology in our favor, we are doing it laparoscopically, meaning minimal invasive procedures. Take a long time, need to be done for an expert team. They are dedicated to bariatric surgery. But, however, you need to accomplish certain factors and items and conditions to try to be eligible for that kind of surgery. There are several of these or those ones. Yeah, endoscopic sleeve of the stomach, meaning you make certain plicature of the mucosa of the stomach inside of the stomach by endoscopy. They are the sleeve laparoscopically, where you cut part of the stomach but in the vertical axis, and you do the gastric bypass, as we spoke before. Meaning, they are important surgeries, meaning it's surgical procedures. What is the difference between Orbera gastric balloon and our program? For bariatric surgery to be accomplished in the proper program that also we will have, bariatric surgery in our hospital and our setup, is to accomplish the diet, the training to lose certain weight, to reduce complication when you are obese people. Obese people already for his own, as we spoke before, we need to accomplish even in our program. And sometimes there are patients that don't need to go straight away to bariatric surgery because they are more than 40 of body mass index, BMI, but the one they are between 30 and 40, we can put the Orbera gastric balloon. There is non-surgical procedure that we put on via endoscopy, reduce the capacity of the stomach, reduce the emptying of the stomach, and help you together with diet and exercise to reduce a lot of weight. What is the condition of the Orbera gastric balloon? Is just to be there until you reach your goal. That need to be in less than a year, because Orbera 365 gastric balloon is only for 1 year. Meaning, when you accomplish the goal that we are trying to get is reduced, for example, you need to take 20 kilograms, we will take you a year to discipline you first, but you will lose the amount of kgs that you need to lose. And later, if the patient needs, we can consider to tell you, okay, now you are eligible for plastic surgery. We can do dermonopectomy. We can do surgery to reduce your skin hanging or the fat that is already losing, and we can do the plastic surgery. That is our advice. That's why our second key point today in the discussion was the difference between bariatric acid balloon is non-surgical procedure and the bariatric surgery is a surgery that need to be hospitalized for, need to be on the general anesthesia and have a lot of complications per se. All right? Thank you so much. I hope that you continue with us. Feel free to contact us and ask for any question that you need to understand and continue with us. Thank you so much.